watching WESH 2.
This week on Get the Facts COVID, we're talking to Dr. Eileen Marty. She is a renowned infectious disease physician and professor at Florida International University, and she's helping us determine what's true and what's false about the various coronavirus vaccines. So let's dive right in. This past week, you might have heard that you should avoid pain relievers before the vaccine. Dr. Marty says the data on this one is limited, but here's what doctors do know.
So there is some data that suggests that if you take a painkiller before the vaccine, you might blunt some of the immune response. And it's more important to avoid it just before the second one than before the first dose.
Our next statement we put to the test came from one of my own family members who heard that if you get the first dose of the vaccine and then you get the coronavirus, you have to start the vaccination process all over. But is that really true?
Absolutely not. What we do ask is that you are no longer symptomatic with COVID-19 and that you've pretty much resolved it before you get your second dose.
This one is very important. Some people believe that after receiving the vaccine, you cannot transmit the virus. Is that true or just a myth?
That is false. That is totally false. What we do know, and there's some preliminary data from Moderna and more definitive data from AstraZeneca that you're less likely to transmit the virus, which is not the same thing as not able to transmit the virus. For example, in the recently reported AstraZeneca study, they showed that you had about a 33% chance of being able to transmit the virus.
Another way to think about that is the vaccine reduces your chance of transmitting the virus by 67%. And finally, it's understandable why people would want to believe this one. The vaccine will protect against COVID-19 for life. But Dr. Marty says,
no, we don't know that. And it's very unlikely to. And the reason it's very unlikely to is because normal infection with coronaviruses rarely provide immunity for more than a few years. And often it's not for more than a few months. We still don't know how long immunity is going to last from the vaccines. And remember, there are very different kinds of vaccine strategies being used. Some strategies are so well scientifically devised that they're likely to provide a better quality of immunity than having had the infection. In fact, they will provide a better quality immunity than the infection. But for how long it lasts, it's a wait and see thing right now.
Welcome back to Get the Facts COVID. This week, we are once again talking with a local doctor to get to the bottom of some myths circulating about the coronavirus vaccine. So let's jump right in. When you go to get your vaccine, you might be asked if you have gotten any other vaccines. It's been said that if you get another vaccine within 2 weeks of the coronavirus vaccine, that the coronavirus vaccine is less effective. But is that really true? Here's Dr. Michael Tang.
That's kind of an I don't know. So the idea is that we're trying to avoid any problems by having this 2-week buffer period between the vaccines. We don't know if it's going to affect either vaccine take. So we're trying to be careful there.
Next, we've heard a lot about this next topic. When should you get your second dose? You may have recently heard that you can wait up to 42 days after your first shot to get the second. Let's see what Dr. Tang has to say about this one.
That's true. It's not recommended, but what they're saying is that if you get a first dose and there's some kind of delay that there's nothing you can do about, then it's okay to do it up to 42 days. But after 42 days, you really have to start the whole series over again. So it's better to do it in the right time frame.
What about if you had problems or bad reactions to vaccines as a child? Does that mean that you'll definitely have a problem with this vaccine? Dr. Tang says not necessarily.
I wouldn't say like false, but I would say that these vaccines, especially the Moderna and Pfizer, are very different from the vaccines you get as a child. So it's unlikely that you'll have problems with these.
And finally, we wanted to clear up something about the vaccine and obesity. It's been circulating online that the vaccine doesn't work as well if you're obese, but Dr. Tang says that's not the case.
That's false, because they actually included people who were, had a BMI of over 30 in the vaccine trial. So they actually did look at that specifically, and it works just the same in obese people as in non-obese people.
All right, so I'm speaking with local doctors and getting reaction from some of the top medical advisors in the country every single week. If you have any questions, feel free to reach out to me on Facebook or Twitter, and hopefully we can get your questions answered for you. It's time for Get the Facts COVID, and this week we sat down with two doctors to help keep you informed about the coronavirus vaccine. So first up, let's talk about the governor's announcement that people at risk and under 65 are now eligible to get a vaccine, but they need a doctor to sign off on a new form before they get the shot. Some people were told that their doctor had to fill out the form twice, before the first dose and then before the second dose. Let's find out if there's any truth to that with Dr. Rajiv Ball.
That's false. Patients who are looking to get the COVID-19 vaccine, whether it be the one-part series or the two-part series, only actually have to have that form signed once. They can use that form on both vaccinations that they're going to require for the Pfizer and the Moderna vaccines.
One more thing about that form. Some people have been told that the doctor who signs off on your eligibility form must be a Florida doctor. But Dr. Ball says that's not the case.
False. The doctor that needs to sign off on that form just needs to be a practicing physician in the United States with a valid license. We have a number of people that are considered snowbirds, or people that are visiting the state of Florida and spend a significant amount of time here. If your primary doctor is from out of state, they're eligible to sign that form as long as they have that valid license.
Next, we've heard a lot over the last year about how your blood type might impact how severe you get COVID-19. But infectious disease physician Dr. Antonio Crespo with Orlando Health says that's still unclear.
There has not been any specific or clear information about that or reports about that, but there is some reports that maybe that is possible and that the virus can actually bind more forcefully to the cells of the people with a blood type A. So I think we need more information about that.
Now, the reason we're bringing that up is because some people think getting a vaccine isn't necessary based solely on their blood type. Dr. Crespo says that's not true at all.
Everybody has to get the vaccine. Having a certain blood type doesn't give you protection against COVID-19.
This next one is so important. Maybe you've heard someone in your life say that they don't want to get the vaccine because people have died from it. We asked Dr. Crespo, has anyone died as a direct result of the vaccine?
False. We don't have information that there has been any direct death associated with any of the COVID-19 vaccines. It has to be, people have to understand that when you get a vaccine, any vaccine or actually a viral infection, that can activate some autoimmune diseases when your own immune system reacts against you. And there might be some of those diseases that could have bad outcomes and even death. But doesn't mean that necessarily it's because of the COVID-19 vaccine that caused that. It's just a reaction of your own immune system. But death directly linked to the vaccine, not that we're aware of.
We're back for another week of Get the Facts COVID, and today we're sitting down with Dr. Herman Gastambide to get to the bottom of some of the things that you may have heard about the virus. So let's dive right in. Some people are saying that they're not getting the COVID vaccine because it doesn't protect you from actually getting sick with COVID-19.
You still can get infected by the virus, but the chances of that virus going into a full illness and disease process are less than 1%. But you have to understand that the vaccine is not a force field. So you can still get infected with the virus. That is not being prevented. What is being prevented is that infection producing a disease and you being able to pass on the disease to others. That is being fully prevented by the vaccine.
Next up, some people have been saying that the vaccine has something in it known to cause anaphylaxis. Let's see if that's true.
That is incorrect. What happens is, at the end of the day, we are all snowflakes, meaning each and every single day in the United States, we're vaccinating 2 million people. Some of them might have a reaction to some of the components, but the components overall are not allergic in any way.
A lot of people are concerned about what's in the vaccines, and one rumor circulating is that the COVID-19 vaccines were developed using fetal tissue. Listen carefully to what Dr. G has to say about this one.
Yes and no, and that is a very sensitive subject, but I think it deserves proper information. So they are using fetal cell lines that were collected in the mid-'80s. So this is not ongoing collection of lines. It has no fetal tissue in them. And what the Johnson & Johnson vaccine is using, is using those cell lines in the production of the vaccine. But the vaccine itself does not contain any fetal cell lines or any fetal tissue.
Next up, some people are saying the vaccine wasn't developed with minorities in mind and wasn't tested on minorities.
Studies for medicine have always been underrepresenting minorities, and this has been going on for many decades. But I can tell you that the studies done for the Moderna vaccine and for the Pfizer vaccine are leaps and bounds in significantly improvement over prior studies. And yes, there's still underrepresentation in the African American community, but it's actually an overrepresentation of the Latino Hispanic community.
It's time once again for Get the Facts COVID, and we have a lot to get to this week. First, there's still a lot of talk about the Johnson & Johnson vaccine after health officials put the shot on pause for 2 weeks. And you've probably heard FDA and CDC officials said that J&J inoculations can continue because their benefits outweigh their risks. Now, you might be wondering if that's true. Here's Dr. Rajiv Ball.
That's exactly true. The counter-surveillance organizations that monitor vaccines did their job. We saw a threat out there that could be potentially linked to the Johnson & Johnson vaccine. However, after rigorous review, we've come to realize that this is actually not as bad as actually receiving COVID-19 or even dying from it as well. While there have been 6 cases of these severe illnesses, these are very small in comparison to the larger manifestations of receiving COVID-19.
Next up, now that the Johnson & Johnson vaccine is in use again, maybe you've heard that people should look out for certain symptoms for 3 weeks after getting the shot. And Dr. Rajiv Ball says that's true and explains that recommendation a little further.
This is true, but this is always the case. Anytime you take any medication, you should be aware of what your body is doing, whether it's receiving any symptoms of scratching, itchiness, or shortness of breath. Now, some of the more severe complications that we were seeing in those 6 individuals after receiving the Johnson & Johnson vaccine were stroke-like symptoms. That's numbness and tingling, severe headaches, loss of consciousness, or even loss of functionality of one part of your body. However, you should always be aware when you receive a medication or a vaccine, but we shouldn't be overly concerned about these complications. Still continue to get those vaccines as quick as you can.
Some other symptoms to look out for: abdominal pain and leg pain. Okay, finally, today, a lot of vaccine hesitancy revolves around FDA approval. It's been widely reported that the vaccines received an emergency use authorization from the FDA, and many say that means they didn't go through a full testing and review process. So is that true or false? Listen to what Dr. Ball has to say.
That's true. Emergency use authorization is a technique that the federal governments and healthcare officials are able to use to help put medications and counter surveillance out there to help reduce a medical complications such as the COVID-19 pandemic. The full authorization usually takes multiple years to get through. However, EUA is a process that we can use immediately to really get help to the public as fast as we can.